Hi, everyone. Welcome to our webinar, our October webinar of Building an Inclusive Benefits Package. I see a bunch of people coming in right now, so we will be getting started really soon. Thank you so much for spending your morning or I suppose early afternoon with us, depending on where you're at. So my name is Dane Castillo. I'm the marketing associate here at Edgility, and I will also be your technical support today. So just a few housekeeping things as people come in. So we will have time for participation, but if you have questions throughout the webinar, feel free to drop them in the chat and we'll do our best to go ahead and answer them. You can also use the Q&A function if you prefer that. Other times during the webinar, we will definitely want to have your feedback. So feel free to add your comments into the chat for that moment, or we'll ask you to use the raise hand button, and then we'll go ahead and unmute you for that. All right, looks like we've got some more people coming in here. Perfect. All right, and just a reminder, we will be recording this, so we'll send this out to you. We know that life happens, so if you have to jump out, no worries. We will go ahead and get you this webinar recording after. All right, so I'm going to drop our first question in the chat here in just a moment. And that first question, you can think about it here, is going to be basically, while you're sending them, you can share your name, pronouns, and your favorite Halloween candy. So go ahead and think about that. And let's see, it looks like we got to go ahead and get this ready for you. Perfect. All right. So once again, welcome to our webinar, Building an Inclusive Benefits Package. We'll get started here in just another moment. I see more and more people coming in. Just a reminder, there will be time for participation throughout the webinar. You can go ahead and add your comments into the Q&A or in the chat. If you have any questions, we'll go ahead and do our best to get to you. Other times we'll ask you to use the raise hand button, and then we'll go ahead and unmute you so you can share out your thoughts or your questions. So we really appreciate your participation and appreciate that you are here with us today. And once again, we are about to get started, so I'm going to have you go ahead and share who you are. So share your name, your pronouns, and our question today, what is your favorite Halloween candy? I will go ahead and go first. See, when I was a kid, I really enjoyed Snickers. So that was my favorite one. All right, so as I see, there's more and more people come in. Feel free to drop that in chat whenever you like. And then I will actually, I think, hand it over to Jen so she can go ahead and introduce herself and get us started. Jen is a principal here at Edgility, and I'm really excited for her to share this, all of this information with you today. So yeah, I'm going to hand it over to you, Jen, and you can go ahead and take it away, get us started.
Excellent. Thank you, Dane, and thank you for the introduction. As Dane mentioned, I go by Jen, and my pronouns are she, her, and hers, and I am a principal at Edgility Consulting. I'm also a proud member of the LGBTQ plus community, and I'm excited to be here with you all today and to talk about benefits, and particularly, what we're seeing around benefits for LGBTQ plus staff, what we're seeing as best benefits practices, and then what we're seeing for trends around benefits too. So I looked through, as you all were coming in, looked through participant names. Happy to see folks I know on that list. Happy to see some of my past clients there, as well as contacts that I've made during my time at Edgility. And so just excited to be here with you all today. I actually started my career as a scientist, and I have my Ph.D. in cell biology from Harvard, and for 15 years, I was a cancer researcher at Harvard and at a nonprofit called Cancer Research UK in London, England. Before pivoting all of those data research and analysis skills into compensation. And for the last 6.5, almost 7 years now, I've been focused on building compensation programs and practices at nonprofits and charter schools. And I started with Edgility during the very early days of their compensation practice. And have worked with one of our co-founding partners, Alice and Wyatt, to build that practice. So I bring a lot of institutional knowledge to the work that I do, as well as, I think I mentioned earlier, that broader knowledge of compensation. And I use compensation oftentimes interchangeably for salary and benefits. Certainly benefits are included in there, but just have that broad knowledge when it comes to really salary and benefits in the nonprofit space and in the charter school space and in the broader social justice space. In terms of Edgility, at Edgility, we strongly believe that with the right leaders and talent systems in place, organizations can achieve equity. And through our consulting and executive search practices, we partner with social justice organizations to bring practice and structure into alignment with the organization's values so that they can build intentional equity into their talent systems. And we do that through our 3 service lines. Our service lines are focused on running equitable searches that place exceptional leaders, creating transparent compensation programs that close wage gaps, which is where this benefits work typically falls. And then our last service line, which is around building equitable talent practices that close opportunity gaps. And as a testament to our work and our commitment to diversity, equity, and inclusion, 79% of candidates placed in Edgility searches in the last 3 years identify as people of color, and 65% of candidates placed in searches identify as non-male. As well as 96% of our clients say they are very satisfied, very satisfied, or extremely satisfied with Edgility's work. In terms of who we're working with at Edgility, we work with social justice organizations that run the spectrum from single-site charter schools to national CMOs, from small local nonprofits to large national or international nonprofits, to for-profit organizations with a strong social justice stance. And at Edgility and myself personally, I have worked with clients, and we work with clients from a broad number of sectors, including education, policy and advocacy, healthcare, consulting, and human rights. So as I mentioned briefly when we got started, today we will focus on equitable benefits for LGBTQIA2S+ staff. We'll spend some time talking about general benefits best practices, and then we'll finish up with benefits trends identified in our 2022 National Social Justice Sector Benefit Survey. But before we get started, I'd like to ask a poll question. You should see the question just pop up if it hasn't already. But the question is, how well do you understand benefits at your organization? And we'll take about a minute or two for that, for everyone to answer that poll, and then I will read back the responses. Okay, so we've got about 81% of folks have participated. We're up to 84, so that number's still creeping up. So I'm going to wait maybe another 30 seconds for folks to respond, and then I'll read back those responses. Okay, so what I'm seeing is about folks, half of the folks on this call responded that they understand benefits at their organization very well. About the other half responded either okay or not very well. And so that's excellent. So we have, about half of participants feel like they have a really good understanding of the benefits at their organization. And then we have, some folks that are still learning those pieces around how benefits work at their organization. Certainly the hope is today that everyone in this call learns a little bit more about benefits and walks away from this call with some really meaningful ideas to think about in terms of the benefits that they're offering to their staff and how they're approaching benefits at their organization. So first, I'm going to start with talking about equitable benefits for LGBTQIA2S+ staff members, and you'll hear me switch between using LGBTQIA2S+ and LGBTQ+. Moving throughout the call, I will be using both of those as I talk today. So just to begin, 18% of nonprofit sector employees surveyed in Edgility's talent equity assessment have self-identified as members of the LGBTQIA2S+ community. And an additional 16% from our survey selected prefer not to self-identify when asked about their sexual orientation or gender. As well, recent studies show that 1 in 3 adults between the ages of 18 and 29 know someone who uses gender-neutral pronouns, and nearly half of Americans now see gender on a spectrum and feel comfortable using gender-neutral pronouns. So what this tells me is that while we have certainly come a long way towards building LGBTQ+ and gender-inclusive work environments, there is still work to be done to ensure that all staff feel comfortable bringing their full selves to work. In addition, according to a 2022 poll run by YouGov and LinkedIn, 49% of LGBTQ+ professionals indicated that they would not work at a company that does not have LGBTQ+ friendly benefits. And as that population of those who identify as LGBTQ+ grows, offering equitable benefits is going to be more important than ever when it comes to not only retaining staff, but also when it comes to attracting staff to your organization. So what can you as an organization do to make sure that you are truly providing an inclusive environment for LGBTQ+ members of the LGBTQ+ community? First, 56% of LGBTQ+ professionals say that their mental health has been affected by recent anti-LGBTQ+ legislation. And 35% of LGBTQ+ professionals are looking for their company to provide additional mental health resources. So one of the first things you can do is make sure that your mental health, mental health, and particularly in this day and age, that virtual mental health services are covered by the health plan you offer. Most health plans will cover mental health, and whether or not they cover those virtual services, that can vary from plan to plan. So really important to make sure that virtual mental health services are encapsulated in the plans that you're offering, to ensure that your staff, whether they're remote or in person, can have access to can have access to mental health services that meet their needs. Other resources that can be particularly useful and are appreciated by staff around mental health include wellness stipends and things like provider guides that identify whether a provider specializes in LGBTQ plus mental health. Because it isn't only about finding a mental health provider, it's also about finding one that can help you where you need that help. And so being able to find those providers who specialize in LGBTQ plus care is particularly important. The next thing I want to talk about is family leave. So when considering family leave policies, it's important to remember that maternity leave is focused on covering a birthing parent's recovery from birth. It does not cover the non-birthing parent. And so when we're working with organizations, we're recommending that they provide family leave regardless of gender identity, and not only because it's equitable, but also because it could be interpreted as discriminatory against protected class if your family leave policies aren't inclusive of all gender identities within your organization. And certainly it's something that has come up with my clients in the past, and would highly recommend that you go back and just look at your family leave policy if you have a paid family leave policy in place, and just ensure that that policy is being applied equitably and fairly across your organization, and that all staff are eligible to take that leave. Also, really important to recognize and name here that I'm talking about family leave, and I'm going to present later in our time together our most recent data around what organizations are offering in terms of family leave, but I've differentiated it from parental leave because family leave is a little bit broader than that. Family leave allows not only for parents to take off for the care of their children, but family leave allows for caregivers to take off time to care for anyone in their family. And that can be especially important for staff members who may have a parent that they need to care for, or possibly a grandparent that they need to care for, or someone who may not be a dependent, but they need to care for. That having that time and that space to take that time to care for that person is going to allow your staff to feel well supported and feel included in your work environment. It's important to remember that for all individuals, including LGBTQ plus individuals, birthing a child is not always a possibility without intervention. And so we encourage organizations to consider providing adoption assistance and infertility treatment to support these individuals. Adoption assistance comes in a variety of forms. It could be an adoption FSA, so a flexible spending account. It could be financial assistance, so a set dollar amount paid towards the adoption fee, or it could be resource guides that share information specific to adoption. Similarly, infertility treatment options infertility treatment options come in a variety of options as well, but oftentimes you want to make sure that they include sperm donation, IVF, and if possible, surrogacy. That's one that oftentimes won't be covered, at least under health plans. And then it's critical to also ensure that if you offer these benefits, that all staff are eligible to receive them regardless of their relationship status or type. When talking to your benefits provider, you'll want to ensure that your current health plan covers gender affirming treatments. And those treatments typically are either medical interventions, which can include hormone therapy, and surgical interventions such as top surgery. And then we encourage the organizations we work with to make sure that benefits coverage is not only for married couples, but that it extends to domestic partners, and that the benefits also extend to children of employees. So it may not be the employee who wants to transition, but it might be their children or their partner. And so it's a key to having an inclusive policy is ensuring that those options are available not only to the staff member, but their dependents and their partners as well. And then lastly, to ensure that all staff feel included, we encourage all our clients to make sure that all benefits documents use gender inclusive pronouns. And before we move on to my next slide, I want to just pause for another quick poll. How many of these, and you'll see it pop up on your screen again, how many of these LGBTQ plus inclusive benefits does your organization offer? And I'll give it about another minute like we did for the last one. All right, we've got about 82% of participants are in. I'll wait a couple more seconds and then we'll close down the poll and I'll read out the results. Okay, so we see a really nice Gaussian distribution, which I'm a data nerd, so it's a bell curve where we're seeing the bell of the curve is falling right in the middle around either a few of them or some of them. So about around 35 to 40% of you answered a few of them, and about 35 or 40% of you answered some of them. So if you're falling in that, if you fall into one of those two curves, you're definitely falling right within that bell curve and really falling right where the rest of the market is. Certainly if you're above that and you answered many of them or all of them, you all are exceeding where the market is. And if you answered none of them, then, of course, go back, look at your benefit policies and practices and see if there is a way for you to integrate some of the suggestions I just had. So moving on to our next slide, what are some of the best practices? What are some best practices for LGBTQ plus benefits? So first, we recommend that folks be intentional about designing their benefits packages. And while certainly, this includes the equitable benefits I just discussed, I want to focus at a level that's a little bit higher than that and talk about who provides your benefits administration. So many nonprofits and as well as small for-profits use PEOs or other types of benefits administrators. And we recommend when looking into and picking a service provider, look for service providers who focus on diversity, equity, and inclusion, and who understand the nuances of offering an equitable and inclusive benefits package. Those are going to be the folks that are going to be able to answer any questions you might have around those benefits I just presented. And they're also going to be the ones who can answer your staff's questions that they may have around what their health, what say their health insurance covers, or what their paid, who the paid family leave is covers. So really important to make sure that when choosing a benefits administrator, that you're choosing someone who can help you in those key areas. And remember, the goal with benefits is not to cover the lowest common denominator. So it's not to just, only offer the benefits that most people take. The goal of benefits is instead to wrap staff in a warm blanket. And so I like to think about, these nice, cozy staff wrapped in a warm blanket of inclusive support. So they feel like their organization understands who they are and provides benefits that are tailored to them and that work for them and their families. We encourage you to continue to be proactive by attending seminars like this and seeking information so that you can stay on top of the latest trends, so that as they come up, you can investigate them and integrate them where appropriate. And this is going to sound silly, but oftentimes, one of the best ways to hear about latest trends is through the news. A lot of times, the articles that are coming out around the workplace and around talent practices are focused on best trends or focused on trends and best practices. And so that can be one place where you can kind of be proactive and gain more insight in this space. And then lastly, be helpful. The goal of benefits, again, is to provide that wraparound support to staff. And let's face it, the US does not make healthcare easy or other benefits easy to understand. In fact, I've been doing this for a long time, and as well as I think I can grasp an insurance policy or health benefits and read through it, I still get surprises. I'm still surprised by things, and I still don't understand things. So when staff come to you with questions or concerns, be helpful, ask clarifying questions, and try to understand their needs. Certainly you won't be able to fix everyone's problems, but a listening ear and kindness and being helpful go a really long way in terms of, again, staff feeling like they're, wrapped in that warm blanket and working in an inclusive environment. And so before we move on, I have a quick question, or I have a question for you all. What questions do you have about benefits tailored to LGBTQ+ staff members? And I'm going to pause for about a minute. You can just raise your hand. And if you raise your hand, my team will unmute you so that you can ask the question.
Hi, this is Joel Madrid from the KIT Foundation. I use he and they pronouns. I was wondering if anybody has a best practice around how organizations report data on non-binary staff to benefits carriers. And the reason I'm asking is because the benefits carriers that we use, most of them require a binary gender designation. And it's really difficult sometimes to explain to staff why that is.
Yeah, really good question there. I think for me, this goes back to my point around being intentional, and if you can, choosing benefits administrators that understand the importance of diversity, equity, and inclusion, so that you can work with an administrator that already has non-binary options integrated into their systems. Certainly, depending on who your administrator is, you could certainly, it doesn't hurt to ask them if that's a possibility, or if they've considered it and talked to them about it. So I would say that that's also another option there. But if you have the option to look into benefits administrators, or if it comes up where the organization is looking to change, certainly you can make that a priority when you pick a new administrator. I will say we are seeing, well, we haven't seen it in the benefit space, we are seeing most of the organizations that we work with now using more than just the binary descriptions for gender identity. We're seeing most of the organizations we work with providing staff with a host of options so that they can truly self-identify as themselves. can truly self-identify themselves. And we know, at least within those HRIS systems, as it sounds like you're doing at KIP Foundation, that information is getting stored in your HRIS system, and you are accurately tracking. It sounds like you are actually tracking those self-identities in your system. And it's just unfortunate to hear that, providers outside of your organization haven't caught up there, or fully caught up there. Are there other questions? Okay, good. I will keep going. As Dane, I think, said early in the talk today, as you all were joining, you can drop questions in the chat, and I'll try to answer them as I go. And then we should also have a little bit time at the end for questions as well. So to keep us moving, so Edgility runs what we call our talent equity assessment with all of our clients. And so we have a wealth of data around talent practices at the organizations that we're working with. And one thing we've seen in that is that only 68% of nonprofit sector employees surveyed with that talent equity assessment say that they agree that their organization's benefits are fair and appropriate. And so that's important to keep in mind. Yeah, 68% certainly is, it's a good chunk of staff. It is the majority. And as I mentioned earlier, with that warm blanket that we're focusing on wrapping our staff in and providing them with support when it comes to benefits, 68% is not 100, right? And so there's still space there to improve the benefits that are being offered so that all of your staff can feel like they're truly working in a supportive and inclusive environment. And so in terms, and why that isn't so important is that inclusivity has its benefits, right? Inclusivity increases recruiting, so it increases attraction of staff to your organization. It certainly increases retention. It ensures that you don't fall behind the curve. It takes a disproportionate burden off of underrepresented employees so they can focus on their work. And this is so important at organizations, at all organizations, is making sure that that burden is owned by the employer. So again, the employee is free to focus on their work. And it also just allows your organization to live out your values. So a quick question for the chat is, what disproportionate burdens do you recognize that LGBTQ+ staff members may face in the workplace? And you can just drop your responses in the chat. We'll pause for a minute or two here, and as responses come into the chat, I'll read them off here and there, and then we'll move on. Yeah, great one. So finding providers that specialize. Yeah. Taking leave and advocating for leave. Yeah, tokenizing, really good one. Yeah, whether or not they can bring their authentic selves to work. I think, that 16% in our surveys that prefer not to self-identify their gender identity or their sexual orientation in what is an anonymous and confidential survey. Just, shows that there are a group of staff who don't feel comfortable, even in an anonymous survey, identifying their authentic selves, or may not feel comfortable identifying their authentic selves. Yep, leave policies that may preference biological children, certainly. Accessibility, certainly. So lots of great things, lots of great things coming up in the chat here, and encourage you to keep, as you continue to think about it, keep dropping those things keep dropping ideas in the chat. So the next thing I want to talk about is just kind of what we're seeing right now in terms of other benefits best practices. So, of course, first survey your staff to understand their priorities around benefits. At Edgility, our talent equity assessment asks questions across the talent life cycle. And as of that part of that survey, we ask not only if staff are using the benefits they're offered, but if they understand how to access those benefits, right? Because it's not only about using them and who uses them or how often they're used, but it's also about, does your staff even know how to access those benefits? And if so, are the benefits fair and appropriate? And so this goes towards, are you providing transparency to your staff? Are you clearly communicating to your staff so they understand how to access those benefits? And are the benefits, are the benefits equitable and fair to all staff? Next is be transparent. Make sure your benefits policies are clearly written, consistently applied, and transparently shared with staff. This means storing benefit summaries in a place where they can easily be found and accessed. And so one thing we do at Edgility, a practice we have, is that we have a board right in our project management tool called Monday that has links to critical compensation and benefits policies. So staff can easily find that information any time of day or night without having to try to dig through our G Drive or our OneDrive or whatever drive that you all are sharing across the organization. Instead, they can just go right to that board. They know the information is there and they can pull it up and read it whenever they need it. In addition to being transparent, be loud. Be loud is about taking transparency to the next level. I can't tell you how many focus groups I have sat in where staff tell me that they don't know how to access parts of their benefits plan. So this is, and so when I hear that, I think, gosh, I know the organizations I work with have done, put so much effort into designing benefits plans that are useful and meaningful to their staff, and it's falling, in some ways it falls flat because staff don't actually know how to access that information. And so what that means is that not only do you need to be transparent, but you also need to make sure that you're regularly communicating out with staff where they can find those materials. And so what that's going to look like is going to be, in a team meeting once or twice a year, communicating with staff what your benefits policies are so that they know what those policies are, and then just making sure that benefits are a part of your onboarding process. So that you're keeping current staff up to date in those team meetings, and then anyone who may be coming in new to the organization is introduced to the wealth and variety of benefits that you offer very early in your tenure at the organization, so that they can ensure that they take advantage and use those benefits that you have worked so hard and put so much thought into offering. Also, don't forget dependents. As you'll see in the next few slides, the market standard is to cover at least 50% of healthcare premiums for dependents. And I'm going to present some data around that from our latest study in a few slides. But if you want to compete with other social justice organizations, you're going to want to make sure that you're offering that as well. And then lastly, burnout is real. It's especially real, even more real it feels right now, as we come out of the pandemic, and people are tired and they're overwhelmed. So developing policies and practices that allow your staff to care for themselves and take time to rest and rejuvenate will help your staff to recover and feel like they are truly cared for by your organization. And again, I'm going to talk more around this burnout piece and talk more about what we're seeing as some of those new policies and trends coming out of the pandemic. So with the pandemic, there has been an uptick in wellness and mental health options offered to staff. And this includes things like wellness stipends that can be used to cover exercise, or oftentimes I've seen them also cover apps like Calm or Headspace that you may have heard of, that are like meditation apps. As well as I mentioned earlier, mental health options such as virtual appointments with a licensed therapist. Certainly, we've seen time off increase in the nonprofit space over the last few years. When I first started running these studies, benefit studies at Edgility 5 or 6 years ago, the nonprofit space was averaging about 35 days of paid time off a year, including holidays. And our most recent study that I'm going to present today shows that now, 5 years later, it's actually closer to 44 days per year at organizations that offer sick and vacation time. So we're seeing organizations offer more paid time off to allow staff that time to truly rest and rejuvenate when they're burnt out. We're also seeing things increasing. We're also seeing things like office shutdowns and sabbaticals becoming more prevalent as organizations recognize, and again, that value of being able to truly shut down. And then lastly, organizations are offering, we're seeing more and more them offering tailored benefits practices, such as the ones that I mentioned for LGBTQ+ staff that increase inclusivity and promote a sense of belonging. So we're also seeing shifts there. And the one piece that I think I skipped on this list is remote work. So I want to just make sure I come back to that since I missed it. I'm going to present some data around remote work today and the number of organizations that were in our survey that offer a remote work environment. And I think, for me, just looking at those statistics is shocking and at the same time amazing. So a lot more organizations now as well are offering remote work options for staff so that staff have better work-life balance. Okay, so moving into the results from our study. First are the results around sick days and vacation days, PTO and holidays. So we asked all respondents what they offer in terms of their paid time off. What we saw was that it's about, they're offering on average 8 days of sick leave, 18 days of vacation leave, and about 18 days on average of holidays. So in the US, I think the standard is somewhere between 10 and 12 holidays, at least that are considered federal holidays. We're seeing organizations offer more than that. They're offering things such as personal holidays that, again, are policies that are developed intentionally with inclusivity in mind, because they want to make sure that, in America, our calendar is focused, or our holidays, many of them are focused around Christian traditions. And so offering floating holidays or that staff can use to celebrate holidays that are important to them or to their families is becoming more and more prevalent, and more, we're seeing it more and more at the organizations that we work with. When we wrap this all together, we see it's about, it's 44 days a year when, just adding up these numbers that organizations are offering in terms of sick, vacation, and holidays together. I do want to just quickly point out some stuff on the bottom here as well. In addition, we're seeing certainly about 25% of organizations offered unlimited sick time. So that's sick time with, you know, take and use as you need it. And about 17% of them offer unlimited vacation time. And certainly there are considerations when offering unlimited time. Sometimes it can actually have the reverse effect where your staff, feel like, get worried about, am I taking too much time? How is that going to be perceived by the organization? What is the appropriate level of time? So if you have an unlimited leave policy, it's going to be really important that your leaders within your organization are modeling how to use that time, so that your leaders are taking time off and truly disconnecting, so that staff can see that, yes, we do take time off at this organization, and yes, we should use that unlimited leave as and when we need it to take care of ourselves, because our leaders do that. And then the one other piece on this slide I want to just talk to quickly is PTO days. I have seen this, you know, consistently over my time working on compensation and working with benefits, that PTO days oftentimes come in lower than sick days and vacation combined. So if I were to add together sick days and vacation, that comes in at about 24 days, whereas, you know, the average we saw for PTO days was 14 days. So I would say and PTO typically at most organizations is use it as you need it. And what I mean by that is use it for sick or vacation time. But what I want to say is that if you offer PTO days, make sure that you're not falling behind the market in terms of what organizations are offering for sick and vacation time, because, you know, certainly the results here show that is what is happening, is that organizations that offer only PTO and don't offer sick and vacation separate from each other are falling behind the organizations that separate those two out. So really important to keep that in mind. We looked at medical insurance, and we saw that 100% of organizations offer medical insurance, and that the most popular enrollment was PPO plans, with EPO plans and HMO plans behind that in terms of enrollment. We also looked at, what do premiums look like? So what is the total premium? And this premium includes employer and employee contributions. So on the right, it's the combination of both, so that you can kind of get a sense of, okay, this is, you know, on average what other organizations are offering. How are we doing? Are we getting a good deal on our benefits? Are we paying way too much for our benefits? The numbers on the right can be really helpful for everyone on this call in terms of thinking about that. On the left shows the percentage of premiums covered by employers. And that line in the middle, that red line that goes right down the middle, is the 50th percentile of the market. So if you are at that red line, that means that you are providing or covering the premiums at least as well as 50% of the market. Certainly, if you're below that line, you'll want to just look at that, because your benefits offering may be coming in below market. And certainly, if you're above that line, you are going to be above market. So what is that? You know, what can we learn from this? We can learn that the at-market position for an individual is for an organization to cover between 90 and 99% of their premium for an individual. For an individual plus one, it's to cover between 70 and 79% of that premium. And for two or more staff, it's to cover between 50 and 59% of the premium. We looked similarly at dental insurance and saw that all organizations surveyed offer dental insurance. The average premium for an individual was $45. And in terms of what they're covering for their employees, it's similar to what we saw for medical premiums. They're covering that 50th, again, percentile is falling right between 90 and 100%. So you're going to want, you know, for your dental insurance to make sure that you are covering somewhere between 90 and 100%. And then for individuals and families, it's a little bit lower, it's a little bit less than that, but still a significant chunk of that premium, around 70% to be at an at market rate. And lastly, we looked at vision. Not all organizations offered vision coverage, and I would say this 86% is very consistent with what I've seen over the last 6 or 7 years of doing this work. And as is that total premium, about $10 for vision insurance for an individual. That sounds right on for what I've seen over the last few years of doing this work as well. And in terms of those benefits being the percentage covered, it's a little bit less for vision. It was closer to about, covering 80% of the premium for an individual and covering about 60% of the premium cost for an individual plus family. In terms of retirement, we saw that 96% of organizations are offering a retirement savings plan. And we saw, and this to me was a staggering statistic, was that the average employer match is 6%. And so I went through the data the other day and I had to calculate medians. So I had to calculate, the market rate because I'm a data scientist and that's what I do. And the median is 5%. So it's not like this 6% is just someone totally skewed the data and pulled it up, and the median is 3%. It's not. Organizations are now covering, the market rate are covering 5%. The average is at 6%. They're not covering, sorry, they're providing a match of either 5 or 6%. And that's the market rate for a match. So if you're providing a match less than 5%, you're likely below what the rest of the market is doing. In terms of the types of plans they're offering, the most popular certainly was a 401k, and then 403bs, which tend to be more education specific. As well as we saw some other types of plans in there, like Roth IRAs, simple IRAs, which can be common at small organizations, and other types of plans in there as well. In terms of what those contributions look like, most of them or what the matches look like. For that match, it's usually up to a max %. That's definitely the most common type of match that we see. Some organizations cover up to a max dollar amount. That's less common. And then, of course, there were about 15% of organizations that didn't offer a match. And then something I also see, and I think is important and is stated on this slide, is that some organizations contribute to retirement plans regardless of employee contribution. And when I see that, I love it. It makes me feel warm on the inside. It makes my heart feel full because folks don't always have, especially right now in times of high inflation, when I have to cut, and I can tell you even when I'm looking at what do I cut, retirement is one of the first things I'm looking at. I wish I could cut my taxes. Unfortunately, I can't. That's definitely the first one, but retirement comes in, as a close second. And when you're in those situations and staff have to cut their retirement, that means that they're also losing out on that match. And so, a great way to fully support staff is to provide that match regardless of whether they actually contribute. Moving on to paid family leave, we look at it in 2 different ways. So we look at it at states with paid family leave laws and then states without paid family leave laws. First, looking at states with paid family leave laws, about 50% of organizations in those states are offering paid family leave above what the law requires. And the average of what was offered in terms of number of weeks was 8.9 weeks. And the average pay being offered was 83%. So I've worked in this long enough to know that, most state laws, the majority of them are 6 weeks at usually about 60%. And we're seeing that organizations are offering more than that, right? On top of that, they're actually offering an additional up to 9 weeks and they're covering a larger portion of the person's pay than just the state does. And the reasons why they're offering it, I think I talked to this earlier. It's not only to bond with either a child after birth, but to make sure that you can bond with children who have been adopted, as well as children that you may be caring for as foster parents or as guardians. And then, that last reason on the bottom there is making sure those paid family leave covers care for caregivers who may have to take care of family members with serious health conditions. We also looked at paid family leave in states without paid family leave laws and saw there that roughly 63% of organizations offer paid family leave. So again, the market rate is to offer paid family leave. And what we saw, these numbers have increased over the last few years for sure. But what we saw was that the average being offered was 11.2 weeks of paid family leave per year with 100% coverage of the employee's salary. And so just noting that organizations, that it is common for organizations to offer this paid family leave, and that organizations are making sure that that leave that they offered is generous in the amount of leave that they're offering with close to 12 weeks at 100% pay. And then just finishing up with remote work. So this graph to me, I wish I had this data from 5 years ago because I think it would be inverse. But what we're seeing right now is 61% of organizations that took our survey are fully remote. And so they're offering staff. So staff have the option or staff are working from home. And so that is a huge shift that's come about with the pandemic, with about 40% or 39% of the organizations that were surveyed having a hybrid remote or an in-office model. So we flipped, right? We've gone from in-office being the standard to be in this space to actually remote work being the standard in this space. And then lastly, just going to finish up on this slide with some additional benefits. Certainly important as we look at the table to look at where we see above 50%, right? Because 50% is the market rate. Above that is means that the majority of organizations are offering it. So things like health FSAs, dependent FSAs, short-term disability, long-term disability, life insurance, home office stipends. That's one that's hugely increased. Those home office stipends are really common in today's in benefits packages today. And so would recommend, if you're not offering them, go back, look at it and see if you have could possibly offer those options to your staff. I've seen a few questions come in and we have 2 minutes left. So if it's all right, Dane, I'll start on questions.
Yeah, absolutely. And anyone, if you have to jump, I'm going to drop our survey in the chat. Just let us know how we did today. And thank you so much for joining us. And Jennifer, go right ahead. If we didn't get to your question, we'll go ahead and follow up with you after this webinar.
Okay, so the first question is, I'm with a small nonprofit, and the best way for our small group to get affordable coverage is through CalChoice. How do we go about adding things like fertility treatment and gender affirming treatment? Yeah, really good question. I would say the first thing is just make sure they're not already covered. They may already be covered by your plan. So you'll want to look into that, or covered by typically it's not just one plan. Typically there's even through things like CalChoice, there's multiple plans. You'll want to just check in with them and make sure that those pieces are being covered. Certainly if you have a choice to pick those plans, you'll want to check in with your benefits administrator and say, okay, which ones offer fertility treatment and can I pick those? The next one is, my employer has a focus on racial equity, but hasn't focused on other areas of oppression quite yet. Yeah, we see this so much, and our intersectionality of oppression. excludes any infertility benefits. And I'm trying to try this. Yeah. Because the nature of how we'd have to get pregnant, or my other colleagues who are infertile. Yeah, that is a really good question. So the second question, I want to look into this more and get back to you. Unfortunately, it's anonymous. If you want, please shoot me an email. And I think Dane could drop my email in the chat. Please shoot me a private email and I will make sure to look into this and get back to you with a response. Our org's offering leave specific for COVID. We're seeing COVID less and less right now. What we've seen more and more is that instead of offering COVID specific leave, they started wrapping that into their sick leave and they're increasing their PTO. So we aren't seeing COVID specific leave as much anymore. Instead, we're just seeing more paid time off being offered in general. As part of their benefits package. Yeah, that was not a question in our survey. Certainly we asked about adoption FSAs. This is a question around what are our other orgs offering benefits around surrogacy. And we're not seeing that. And I recognize we're at time. So I will say, I don't want to keep everybody on here. I know everyone has meetings to go to. I want to honor your time. So I just want to finish up and say thank you. As Dane said, if your question is in here and I didn't address it yet, we will get back to you via email. If you put an anonymous question in and you want us to look into it a little bit further, please feel free to email me. Otherwise, just have a wonderful day and enjoy the rest of your week, and please, and take care.
Yeah, and just a reminder, we will go ahead and send you a follow-up email with this information and a recording. So if you do end up having a question, the information to reach out to Jennifer or to us will be there as well. So thank you all so very much for joining us today. I hope you enjoyed this. We love data, and I think Jennifer is fantastic at giving us data here. So thank you all so much and have a wonderful rest of your day. Take care.